Good evening and a very warm welcome to all those who have logged this evening to hear this webinar, Plant Parenthood Post Transplant. Parenthood is a joy, well, for most of us, but we also know that pregnancy can put a lot of demands and challenges on the mother and those around her. What about pregnancy post-transplant? Does that pose additional challenges? Can I become pregnant after receiving a transplant? Is pregnancy safe after transplant? How long should I wait to become pregnant post my transplant? These are some very real concerns of many transplant patients. These are also concerns that transplant professionals have to constantly address. At the same time, we've also heard heartening stories of recipients becoming parents. So should pregnancy post-transplant bring joy or fear? This is what the subject of discussion is this evening. MOHAN Foundation is delighted to partner with the Transplant Pregnancy Registry International, also known as the TPRI, an international organization specializing in studying pregnancy after solid organ transplantation. The TPRI is an ongoing research study focused on the effects of pregnancy on transplant recipients and the effects of immunosuppressive medications on fertility and pregnancy outcomes. A unique feature of this study is the long-term follow-up of the participants. The TPRI provides, also joining our Ms. Kannika Jain and Mr. Vasu Sundar, as they very graciously agree to share their experiences and joys of becoming parents post their transplants.
So, Ali, and thank you so much for inviting me here today to give this talk and present on something that I'm passionate about, pregnancy after transplantation. So the first thing I'm going to do is show a short video highlighting patients who've sent pictures to us and showing successes of pregnancy after transplantation. So as Palavali said, the Transplant Pregnancy Registry International is a voluntary pregnancy registry that has been collecting pregnancy information for over 30 years. Is Kannika there so she can share with us how she did? I know she was on earlier.
Kannika?
Yes, yeah, yes. Hi,
oh,
good evening. Hi, Lisa. Thank you, Lisa. Thank you, Pallavi, for inviting me. I'm honored. It's always beautiful to share my journey. Thank you so much for inviting me. In fact, Lisa, a lot of things that you spoke about in your presentation, I have experienced that. So my kidney transplant was done about 8 years ago. And I was given a go-ahead by my nephrologist roughly 4 years afterwards to have a child. My husband and me, we'd been married a couple of years at the time. I was 33 at the time of transplant, and we were very, very desperate rather to have a child. So our nephrologist was of the view that, your tacrolimus and your other levels, creatinine, everything needs to be in balance before you can plan a baby. And it took me about 4 years to reach that level. And of course, we were informed well in time that, some of the medicines will need to be altered before the conception. So mycophenolate had to be, substituted with azathioprine. Mm-hmm. So, and one thing very interesting, I remember my nephrologist telling me is that I'd like you to be very realistic, because there are times that, couples try to get pregnant for months, and it can take a while. So you'll need to keep your patience, you'll need to keep your positivity in place. So, but I'm very fortunate. I am very, very blessed.
Kannika, I'm just, Jerin, we would like to have full screen while Kannika is talking, while the sharing is happening. Can we please? Yeah, thank you. So sorry. I'm so sorry. Yeah.
No worries, no worries. I'm getting attention. I'm happy. So my nephrologist, one sweetheart, he is like, you'll need to have patience, you need to have positivity. And there are times when couples try for 6 months, 8 months, to get pregnant, and it can take a while. And since the medicines are altered, the kidney functioning needs to be very closely monitored, while you are in that phase of conception, when you're trying to conceive. So he changed my medicines and I conceived. I'm very fortunate, we conceived within my first menstrual cycle. So he was also very happy, shocked, surprised. Oh, yes. He said, you're my first patient where I'm counting the number of days since I changed the medicine, instead of the months. So it was very beautiful. It was very beautiful. Also, one of the important things that we did was, my husband and we did was, we needed a gynecologist who had at least some sort of experience of dealing with pregnancies for kidney transplant recipients. And in India, currently, from whatever little knowledge that I have, it's rare, So again, we found a very awesome lady. She had a lot of experience with dealing with patients like that. And my nephrologist and my gynecologist, they worked in tandem for during the pregnancy, and my labs, my blood tests, urine tests were very closely monitored. Of course, I'm fortunate in another aspect is that I did not experience any backache or any swollen feet during my pregnancy, which is perhaps common for any lady, irrespective whether they are organ recipients or not. And I attribute that to my yoga, because for years before that, I'd been doing yoga. So my spine was very strong. Both my doctors, they operated cautiously. They wanted to proceed proceed with caution. So they stopped my yoga. I hated both of them for that. But oh yes, because I am a yoga and a meditation person, for years now. And that's my strength, my inner strength comes from that, my yoga and meditation. So I walked a lot. And that helped me a lot. Not a single day did I experience any sort of back pain or swollen feet. Oh yes, it's been a very beautiful journey. It's only towards the end, somewhere around 32, 33 weeks, the UPCR, the urine protein creatinine ratio, which was regularly monitored, indicated that now the time has come that, the delivery needs to take place. Kidney is getting impacted and we really need to speed up. So a lot of options were put forth, and they said that, after birth, your child may have to stay in NICU, newborn ICU. I said, that's not happening. So what's the other options? He said that during pregnancy, we can give you a whole bunch of injections, which will help in lung development of your baby, before birth. And I went through some very painful and burning injections in the last 2-3 weeks. Wow. But the good part is my son Veer, he's 3 years old now, and he did not have to go through anything, no pain. He was born effortlessly. He was a happy, healthy child. NICU was really far away from his life. Mm-hmm. And it's been very beautiful, very easy for me. One or two things which were of concern to both of us, my husband and me, was that whether I will be able to breastfeed my child after birth. So since I was on, hopped on a whole bunch of immunosuppressants, steroids and other medicines and blood pressure medicine and all of that, we reached out to a couple of experts in the medical fraternity before conception and during pregnancy. So they said that's not a problem, because even while during pregnancy, in any case, your child is getting that medicine through your bloodstream. So it's not going to affect that. Of course, you will continue to stay on azathioprine and cannot move back to mycophenolate till the time you want to feed, because as Lisa shared, that can affect the fetus, that can affect the baby. So again, I was able to breastfeed my son for 6 months. And after that, my medicines were changed back. One of the very interesting things that happened was that the moment I was moved back to mycophenolate, I had acute diarrhea. I developed a lot of bone and muscle pain for about a year and a half. And unfortunately, since these cases are rare, not much of practical information, experience information is available. Yes, that's right. So that information is not available. My nephro, my gynae, I was in gynae. I was touching with my gynae even afterwards. For almost a year, I was in touch with her. They had a tough time figuring out what's happening because no data, no practical experience information was available. So much of hormones had changed during pregnancy that they affected my bone and muscles. And that in any case is a bone loss and muscle pain and all is in any case a side effect of one of the medicines that we take. I think that side effect kind of kicked in after delivery. However, with some supplements like magnesium and other things, a lot of body massage, a lot of yoga, especially yoga, a lot of yoga and meditation helped me to get back. Milk, of course, I could not drink milk afterwards, because it really changed everything within my body. So milk gave me diarrhea. So now it's been, more than 2 years, and I love milk actually. That was
Kannika, one of the viewers wants to know who your nephrologist was.
Sure, I'm not. I don't mind sharing. I'm not sure if he would. So with due respect to him and a lot of gratitude to my nephrologist, his name is Dr. Saurabh Pokhriyal. He's director nephrology currently in Manipal Hospital in Dwarka in New Delhi, India. Gem of a person, awesome person, not only medically, not only a medical expert. He's been my agony uncle also last 8 years. Oh yes, I complained to him about my hair loss and my husband also. So as all my fellow organ transplant recipients know, a lot of mood swings happen, a lot of hormonal changes happen, and extreme hair loss happens. I keep complaining to him. I said, you don't love me. You don't care about my hair. I've lost everything. So he's my agony uncle as well. But jokes apart, medically, he's an awesome person. He's a medical expert. So where was I? I'm sorry, I forgot.
That's right. I was just going to ask you, so how many weeks were you when you did deliver your son?
Okay, so my injection started around 33, 34 weeks, and my son was born at 37 weeks. It was around yes, absolutely. So he was born about 2 to 3 weeks sooner than the due date. And he was fine. And one very important thing about my life here that I want to share with all of you, all my fellow organ transplant recipients, who are planning to have a child, or even if, those who've already had one. For me, for 16 years since my kidney failure, transplant, and now post-childbirth, my developing on my inner strength, my mental health, my emotional health, my spiritual health, is largely responsible for where I am today. It has changed. I have dedicatedly, I have worked on that. I have learned and I have practiced to balance my body, my mind, and my spirit. So when my mind and spirit has been in balance, it has helped my body. And that's how, my transplant
really is the key, Kannika.
Yes, absolutely.
Yeah. And I think having the planned pregnancy with all of your laboratory values being in check and having your medicines, you had definitely, I think, what I would call the ideal pregnancy.
Fantastic.
Oh yes, I consider myself blessed. In fact, if I may take a minute or more of your time here, professionally, I'm a psychologist. So a lot of my clients are these organ transplant recipients. A lot of them are women who plan to, who are planning to have a child now after transplant. And a large part of my conversation and counseling and therapy with them is around addressing their fear. So many times, most of the time, recipients are scared. Women recipients are scared. Can I have a child? Will I be able to conceive? How easy or difficult will my pregnancy be? Will my child be okay? I'm hooked up on so many immunosuppressants. Will I I have a normal baby? How will my baby be? Will my baby have a normal life afterwards, free from defects or deformities or abnormalities and everything? So, of course, medically, physically, tons of experts are there. And this one thing that I want to share with them is please work on your mental and emotional strength, because once you're able to let go of that fear, everything becomes easy. And I say that with a lot of confidence because I have lived that. I have gone through that.
That's fantastic, Kannika. Yeah. That's real. Would any of our nephrologists like to come in at this point? Any comments? Anything? Dr. Mehta, Dr. Sirsa, Dr. Hegde, anything that you would like to, before Lisa goes back to the rest of our presentation? Okay. Dr. Sirsa, tell me. Yeah.
I think Kannika had a very nice course for her pregnancy, uneventful, and it's the ideal way, actually.
That's true.
Which does not happen for most patients. They have a rocky time sometimes, So, good that she had such a. I think it's her attitude which helped her, because she's very positive.
Thank you.
That's, I think, largely the key. Dr. Mehta?
Yeah, I too agree with what Rasika is saying.
So this is a question for Kannika. She may choose not to answer it, but are you thinking of a second baby?
No, I will not, because I'm almost 42 now, and taking care of a toddler at this age, is very difficult for me. I really don't have that kind of energy to match my child. And it has nothing to do with my kidney condition or any such thing. But it's primarily because I really don't have the energy to handle another baby.
Okay.
I just want to ask Kannika.
Anji.
You had UPCR, which was which increased towards pregnancy, right?
Yes. So towards the end of pregnancy,
how fast it settled down?
You're saying after delivery, how fast it settled down?
Yes.
I'm sorry, Dr. Kalpana, I'm not, I don't really recall that much, but yes, it was pretty normal actually. It took a little while, but it was normal. I really, honestly, I don't remember that. So yeah, I'm so sorry.
That's okay. Thank you so much. This webinar was to explore whether post-transplant recipients who've had children would like to be part of such a registry, so that, data from India can be generated and shared with other patients for them to take, recipients to take informed decisions about pregnancy and parenthood. Would you be willing to do this? Would Vasu and Kannika be willing to be part of such a registry?
Yes, absolutely. Absolutely.
I appreciate your time and everybody joining us today. And if anybody has any specific questions, they're free to email me, and I can send them our annual report or any other reports that we have.
Thank you so much, Lisa. Thank you, Kannika and Vasu, and thank you all the doctors who joined time so late in the evening to join us. Really appreciate your inputs. Thank you, Teresa, for being there. And good night to all of you.
Thank you.
Great evening, everybody. Thank you.